Good morning, everyone. Thank you so much for coming on time, and welcome to the 6th session of the COVID-19 Academy. We are very pleased to have you back with us and sincerely appreciate all your support. My name is Astha, and I will be your moderator today. As you know, the COVID-19 Academy is a capacity building initiative of the NDMA, UNICEF, the WHO India, HCL Foundation, and Sphere India for volunteers and outreach workers from across India to ensure COVID-19 preparedness and response. Today's session is on suggested safe environmental sanitation and hygiene practices that need to be practiced during and also after the current COVID-19 outbreak in households, communities, and public places. These are some very important questions that we will seek to answer today. And to do that, we have our resource person. Today, it's Mr. Sujoy Mojumdar from UNICEF. Mr. Mojumdar is a water sanitation and hygiene, a WASH specialist working with UNICEF New Delhi. He has been an IFS officer and has also worked in the Swachh Bharat Mission and the National Rural Drinking Water Program of the Government of India. He's supporting currently the COVID-19 response on WASH of UNICEF India. Thank you so much for being here with us, Mr. Mojumdar. I will now pass the floor to you. You can please begin your presentation. Thank you very much.
Yeah, good morning to everybody, and good morning to Asta. Thank you. Asta, can you hear me?
Yes, sir, we can hear you.
Good. Thank you very much. And before I start, I wish to convey my regards to all participants who have come and joined today's session. And I thank the organizers, Fair India, and others who have really done a great job by bringing about this facility to reach out to hundreds and thousands of workers across the country. I have a presentation which I'm going to show you. There are around 30 slides in my presentation. I have around 1 hour for the presentation. After that, we will try to have a question and answer session. I shall not be reading out my presentation word to word. The presentation slides will be on screen. Each slide will be self-contained. So if you glance through, you'll be able to understand what the issue is. I shall only pick out the highlights of each issue that will be on the slide and try to present it to you in an understandable manner. I now launch my presentation. So give me a second, please. So as you know, as was explained by Asta just now, save environmental sanitation and hygiene in times of the COVID outbreak. This is what I shall be speaking on. Most of you have been exposed to a large amount of information on the media, on TV and in newspapers about issues of hygiene and sanitation. What I've tried to do is to highlight the important aspects out of what you already possibly know, and also highlight what is being advised by the various agencies, be it the World Health Organization, be it UNICEF, be it CDC from the US, or the Ministry of Health and Family Welfare of Government of India. And that is what I've tried to bring into my presentation. Why this course? There are two things which I want to highlight. First of all, arising out of this COVID outbreak, one of the most important weapons we have is actually information. We need to provide information to as many people as possible, if not everyone, so that they can take steps to protect themselves, their families, and their communities from this outbreak. So providing information on, in this case, sanitation and hygiene practices, and what each person in each family needs to do in this current situation is what should be the objective of everyone. And that is what we shall speak about in today's session. This course hopefully will give you basic information that needs to go out to the communities in the issue of sanitation and of hygiene practices. This presentation is divided into two broad parts. The first part is on hygiene, which will speak on hand washing with soap, why we need to do it, how we should do it, and how do we put up hand washing with soap facilities easily and quickly. The second point in the hygiene practices is the use of face mask. I shall speak more about it when the slide comes. The third one is on social distancing, which is now being advertised as is being advocated by everyone. The second part, so after the first part of this session of hygiene practices, we shall be asking everyone one objective question just to get an idea whether what I'm trying to say is reaching everybody. Then we shall start part 2, which is on environmental sanitation. And that will have three broad areas: management of solid waste, management of wastewater, and fecal sludge management. And again, at the end of session 2, I shall be asking one objective question and trying to elicit answer from everyone so that we get to know whether you are being able to catch the points being told. So part 1. So the part 1, which is on hygiene practices, I have broken up into 6 broad subparts. The first one is on hand washing with soap. Then the second one is building hand washing stations. How can we quickly build? The third is use of face masks. The fourth is on social distancing. The fifth is on disinfectants. And the last is one slide which has just been released yesterday. I've included that, is what to do with waste from COVID-19 patients. So I start with the first part, which is hand washing with soap. Now, why hand washing with soap in terms of COVID-19? Now, as we have learned, there are two things I want to highlight. First of all, does soap work? What happens if we do hand washing without soap? Now, what research has shown in earlier corona diseases and with COVID-19, soap effectively kills the COVID virus by dissolving its outer protective lipid layer that surrounds the virus itself. This forces the virus to disengage from its strata wherever it is stuck, and it dies in that breaking process. Therefore, soap is effective. Any kind of soap is effective. So soap should be used with hand washing. Hand washing without soap is not effective. That is message number 1. Now, why only hand washing? The entry point of the virus to human body is through the mouth, the nose, and the eyes. And invariably, this part of the face gets contacted only with the hand. There is no other part of the body which comes in contact with the face. In fact, there is no other physical structure like doors or walls which generally comes in contact with the face. So it is the hands which come in contact with the face. And therefore, if the infection has to get transferred into somebody's body, it will be through the hands. So it is essential for the hands to remain virus free. Now, the hands can get contaminated with the virus by a couple of ways. One is if the hands get into physical contact with another person who is infected. The other is the hand can get into contact with a body or a surface which has the COVID virus in it. Now, therefore, so even if the hand comes into contact with an infected person or a surface having the COVID virus, we have to prevent that virus which is in our hand from going to reaching our eyes, nose, and ear and our mouth. To do that, your hands need to be washed regularly. Now, how much is appropriate? Now, one of my colleagues has made this what I've written in the red box. There are reports from World Health Organization is that in fact you should wash if you are exposed, if you are outside your homes and you are exposed to possible contaminated areas and persons, then you should really wash your hand as frequently as possible, even up to every half hour. Every time you feel that the person feels that there could have been contaminated bodies in which your hand has come in contact with, then the hand should be washed. So we have, one of my colleagues has made this interesting message: 20 into 20, 20 times a day for 20 seconds each. Hand wash with an adequate amount of soap for a minimum period of 20 seconds. There are advisories now which says that if possible, do 40 seconds. So the longer we wash the hand, the more effective is the killing of the coronavirus. And therefore, we should give the message to everybody that very frequent washing of hand for a prolonged period of time, at least 20 seconds, and if possible, up to 40 seconds. One more thing I want to mention in the last point in this slide, point number 4, is germs from unwashed hands can get into food and drinks also, and therefore food and drinks should be washed very thoroughly before being consumed, especially if they are being consumed raw, like fruits. So this message has also to be conveyed to uh, the people whom you are working with. I move to the next slide. What about hand sanitizers? Now, hand sanitizers are also effective in killing the virus. Now, how effective hand sanitizers are to kill strains of this particular virus is still undergoing research. But historically and in earlier infectious diseases, it was found that hand sanitizers do kill the coronavirus, and therefore hand sanitizers also work. In fact, there have been research in Africa in the case of Ebola, in which it is found that hand sanitizers in some cases are more effective than hand washing with soap. But in general, when conveying uh, to the entire population, we and everybody else is recommending hand washing with soap because of the expense of the hand sanitizers and the simple fact that they may not be available, and many people may not be able to afford. So hand washing with soap is recommended, but hand sanitizers also work. Only thing that should be remembered is the hand sanitizer should be alcohol based. It should have at least 60% alcohol content. And what has been seen in some places, that not enough amount of hand sanitizers are being used each time. So appropriate and adequate amount, enough hand sanitizers should be used each time. The hand should become wet with the hand sanitizer, and the sanitizer should be allowed to dry in the hands before it is cleaned off or wiped off, if at all, with any cloth. Many people I've seen use the hand sanitizer, apply it, rub it for 5 seconds, and then clean it off with a piece of cloth, which actually uh, makes the complete effort ineffective. So it should dry in the hand. This message has to go that hand sanitizers should be taken in enough quantity and it should be allowed to dry in the hand. Another issue that is being seen is hand sanitizers are not very effective when the hands are visibly dirty or grubby with soil and greasy. So, so it should be made sure that the hands should be comparatively clean before hand sanitizers are used. In fact, hand washing with soap or hand washing with water before using hand sanitizers is recommended in case hands are very dirty. Sometimes hand sanitizers, if, as I mentioned just now, may not kill all germs in your hand. So therefore, uh, hand washing with soap and hand sanitizer combination is also an advisory that can be given for people who can practice it. I move on to the next slide. Now, many of you must have seen these slides in the media, in TV, in newspapers, in posters. There are two portions here. If you see 1A and 1B is how to use a hand sanitizer, is to take enough quantity in the hand and spread it and rub all parts, the front and back of the hand completely and for a prolonged period using the hand sanitizer. For washing the hand with soap, you have 7 steps recommended by the World Health Organization. Preferably, they've said liquid soap, but where it's not possible, then a normal soap will come in. All those who are raising the hands, please do. I shall answer the questions at the end. Please allow me to finish, but put your questions in the chat box. I'm sure Astha will collate the questions. I'm coming back to hand washing. The front of the hand, the palm, the back of the hand, between the fingers, from the front, from the back, the hooking the hands together, cleaning the nail portion, cleaning the thumb portion, cleaning the center of both palms with the four fingers of the other hand, and then washing it off, cleaning up to the wrist, and then washing it off with as little hand contact with the knob of the tap as possible, and if possible, clean it off with a clean napkin or a very clean piece of cloth used only by one person, and closing the tap with the napkin or the cloth. Now, this is the standard World Health Organization procedure. I shall show you a small video on this from the WHO. Please give me a second for that to load the video.
There are several practical measures you can take.
1 second.
There are several practical measures you can take to protect yourself from the new coronavirus. One of the most important is regular, safe, and effective hand hygiene, using soap and water or alcohol-based hand rub. Here are the steps recommended by WHO to follow. You too can have safe and clean hands anywhere. Now I'm calling on the world to take the WHO Safe Hands Challenge to be ready for coronavirus.
Yes, I come back. I assume you can hear me again. Please say yes if you can, so
Yes,
that I know. Yeah. Yeah, thank you. I go back to my presentation. Yes, so that was explaining, that was the head of the World Health Organization explaining the 7 steps of the hand washing. I want to point out to the 2 portions of this slide, the bottom left and the bottom right. If you are using a hand sanitizer, 30 seconds. And if you are using soap or water, the revised, so even though initially, as I mentioned in the slide, they said that the seconds, 20 seconds enough, but right, it is advisable now to have at least a 40-second hand wash to be really effective. I move on to the next slide. This slide I've made just to give you an example of the Ebola disease. Now, all of you must have heard about the Ebola virus disease. This Ebola disease has been one of the most difficult viral disease to control in the world. More than 11,000 people have from this have died from this Ebola disease. It was discovered long ago, around 30 years back, but the real huge hit of the Ebola outbreak came between 2014 and 2016 in West Africa, and it became a global epidemic within months. Now, Ebola was transmitted from when a non-infected person came in contact with the blood or body fluids or the body of an infected person. In most cases, it was found that the exposure happened by the physical contact of the face of a non-infected person when the contaminated hands, where the hands got contaminated. And initially, Ebola was almost being, it was very hard to control Ebola. And it was being seen that the largest transmission of Ebola was happening in hospitals. And when it was investigated, it was found that doctors, nurses, and health workers, when they were going and seeing one patient, Ebola patient, and then going and seeing another patient, because their hand washing was not adequate, the Ebola infection was getting transmitted through the hands. And it was only when it was insisted that hand washing by health workers, doctors, and other health workers should be insisted upon. And when that was implemented, it was found that that had a very great effect in controlling the spread of the infection. So this is what I want to point out, is that hand hygiene has historically been a main weapon in controlling the spread of this virus, of the Ebola virus. And therefore, for the COVID-19 also, it is generally advised that hand hygiene will possibly be the main protection beyond its spread. I move on to the next slide. Now, I had mentioned the issue of liquid soap. Why liquid soap? And liquid soap is expensive as compared to normal soap. Now, both soaps work, liquid soap and normal soap. Why liquid soap is considered better is because it's in a bottle, and to take it out of the bottle, if you have a pumping system, then you can use your elbow or your forearm to press that, or in some places I've seen using your feet to press a pedal to make sure that the soap comes out of the liquid bottle into your hand. So it avoids the need of physical contact by hand. And same, the thing of using a soap is that if, of course, a soap will kill the Ebola generally, but it is generally advised to avoid the use of the same soap by multiple people. So even if a soap is given, it will be useful to advise the use of small pieces of soap for individual people, so there is no kind of transfer through soap. That is why soap. How to make your own liquid soap? You can make it using powder soap or laundry detergent and dissolve it in water and keep it in a container, in a bucket or a bottle or a pumping machine, and use that liquid soap that is as effective. 5, as I have mentioned below in the graph picture 1, 5 spoons in 1 bucket of water is enough to make liquid soap which can be used for cleaning. So please convey this. This is very effective and can be used as liquid soap. I'll move to the next slide. Now, it is very clear, as I have explained, that hand washing with soap is important. The government and many agencies are encouraging people to hand wash with soap. Now, obviously, it is easy to do this at homes. But what happens when people go outside their homes? Now we are in a lockdown period. Most of us are in homes. But as you are seeing the situation, most probably there will be a controlled opening of the lockdown. And all of us as practitioners in the wash sector and in the HGO sector will actually go out to the field in the near future, and we have to work with communities and with partners, conveying all these messages, including the message of hand washing with soap. You also are working with government and with other agencies in creating facilities. I am already seeing plenty of interest in setting up hand washing stations in communities, maybe in marketplaces, in bus stands, near banks, places where people collect outside post offices, wherever people will collect. Can we put up systems of hand washing? Of course, you can have a bucket and a soap, something simple, but can it be more structured? So as I've shown in this slide, there are many alternatives that can be done for hand washing with soap. Various kind of models have been made by various small entrepreneurs across the world, including in India. You can have a water bottle container of 10 liters, 20-liter water bottles, make it into a small outlet, uh, and make sure people use that. The main question that I will advise is try to avoid hand contact. So there have been many small innovations which could be, as I mentioned before, operated by feet. And there could be a spring. It's not very hard to construct. I will explain just now. So in a minimum expense, this kind of facilities can be put up, using feet and using a facility for soap. Now, on the right-hand side of this slide is a booklet. This booklet, as you can see, is called COVID-19 Hand Washing with Soap Facilities, a compendium for indicative layouts, designs, and cost estimates, recently released by UNICEF India. I will share with Asta and with everyone. It is there in the UNICEF website. You can check that. And I will also share it to Asta so that she can share it with their partners. This is a UNICEF India manual. I am going to show you two photographs of models that we have collected that people have done in that manual. This slide is a very low cost water tank using hand washing station. As you can see, costing only 3,200 rupees. This is the actual cost. It includes a plastic drum, taps, pipes at 1 meter. Why 1 meter? Because it's social distancing. That is what 1 meter. But in fact, now the advice is to have more than 1 meter. So you can elongate this so that people are not standing close to each other. A structure frame, that's a plastic PVC kind of tank. A fabrication charge of 500 rupees and painting. This whole thing costs 3,000 rupees and can be easily put up. Obviously, you will have to connect it with a piped water supply and have this. The one thing I will tell you, I will advise you to this is that there has to be a drainage system so that these goes into a drain or a soak pit, which I will explain in the next few slides. So this is one very easy model which can be done in the field. This is the model done by our colleagues in Assam, the PhD department. A campaign, they put in a Syntex type tank and a basin, and they have put in, you will see on the feed, this security person is using using 1 feet for the water, the pedal, and 1 feet for the soap, the left one done. And this is already fabricated and the design is here. And the costing, you can see this is costing 13,000 rupees. So in that booklet, which I showed you, we have more designs. We have 6 designs and we are collecting more. And so that any of you can access that and you give it to any fabricator in your area working and they can fabricate this easily. There are other agencies, people who are now branded companies who have started to make it like people like Syntex and others have started to make this kind of hand washing stations. They are a bit more expensive, but you can source it. But what I'm trying to say, don't wait for large companies to do it. This can be done with any fabrications. So you have seen the earlier example was only 3,200 rupees. This one is 13,000. There are other examples between these costs. So between 3,000 to around 15,000, you can have multiple designs of what kind of system, whether you have a pipe, whether you don't have a pipeline, you have to fill it with tanker, whatever situation you have, you can choose the kind of models that you like. Next slide. Now, this I have more or less explained. I've come to the portion where I said what I said. I will talk about face mask. Now, you will know that initially when the corona outbreak started, at that time, the government actually put focus and said that face masks should be used only by medical practitioners and to be used by people who are already unwell or sick. It was not advised for people who were not sick. But over a period of time, now the advice is that actually when you go out of your home, everybody should use face masks, especially when you are in possible close contact with others. If you are alone in a garden, you may not need the mask. But if there is a possibility of anybody to be around you, it is advisable to use the mask. Now, another issue which came, and I saw somebody asking in the question box also, COVID-19 is spread when people, as I said, in fingers in physical contact. It is also spread when people sneeze or cough. And the droplets released during sneezing and coughing, if it reaches the face of another person, it can infect that person. If the droplets stay on a surface, then it is research has shown that in various kinds of surfaces, it stays between 10 minutes to 5 to 6 hours. Now, I don't want to be alarmist at all. I repeat, research is on in this, but if it falls on a surface, it is better that if anybody comes in contact with any sort of surface like that, metal surface or hard surface, one should wash their hand to avoid that reaching the faces of unaffected people. Droplets, as I have said in the third point of this slide, droplets also remain airborne for some time. Now, there are research to show that these droplets can travel. Some research says up to 6 feet. Some research says more than 6 feet. We need to be careful. We exactly, scientifically, we are not sure. This depends on the atmosphere, how hot it is, how humid it is. So what I advise is face mask always whenever people are in a congested place and near possible infected people. Masks, as I've said below in the blue highlighted portion, masks lower the chances of coronavirus entering the respiratory system through droplets still in the air from an infected person. So mask has to be followed. I'll go to the next slide. As you know, I'm sure, since everybody is buying masks, all of you are also buying masks, there are multiple kinds of masks. N95 mask, a triple layer mask, which is also called a surgical mask, and a homemade mask. Now the N95 mask, I have put in the simplest one that we see in the market. There are more heavier and more complicated ones. This mask is generally still advised only for healthcare professionals and people who have possible exposure to infected objects and infected people. Maybe I should add here, maybe my list is incomplete. I should also add sanitary workers. Sanitary workers have possible exposure to infected items. So they should also, I would think, use N95 masks. Now, normally this mask should be changed. Various advisories show various uh, data, but ideally in 8 hours, it should be changed. Doctors have their own instructions. I am not giving any instructions for doctors and nurses. Hospitals have their own instructions. But for outside people like sanitation workers, we should at least, even if they use N95 masks, they should change it every 8 hours. If it is used for more period than that, very carefully, there should not be any leakage. Air should not go in from bottom or top or corners of the mask. Same person should wear one mask. There should not be multiple people using it. And the mask should be kept away from any surface which could possibly be contaminated. The middle one, surgical mask, it's basically for civilians who are moving outside the house for essential tasks uh, where there could be a crowd, basically. If there's a crowd, please use the triple layer mask. It is also made for one-time use, maybe 6 hours, and as soon as it becomes wet, if you wear it for elongated period of, then you will feel itself, I'm sure you have felt it, it gets wet. If it gets wet, please don't use it anymore. And let me highlight here, this mask should not be washed. There is no question of washing this mask. So one-time use, 6 hours until it gets wet, and it should not come into contact with any contaminated person or surface. The third one is the civilians using in home quarantine. People who are in home quarantine should use, they can use the homemade mask, or people who are going to safe public places where there is no question of any crowd or very low crowd. There you can use this mask. This mask can be used on multiple times. It can be washed with detergent every use. It may also be ironed after every use, or after every use means wash it and iron it and then use it. Now, because the government's advisory is that everybody should use the mask, everyone should use the mask. You can imagine we'll need crores and crores of masks. And of course, I know of many NGOs, all of you, many of you may be in the work of getting masks built and stitched and made by SHGs and others. I am going to show you this mask can be made at home, the homemade ones. I'm going to show you a small video just to explain simply how you can advise people to use the mask at home. So give me 1 second, I'll go back to another video.
Here's how you can make your own face covering in a few easy steps with items you can find around the house, like an old scarf, a bandana or a hand towel, or you can make a face covering out of an old t-shirt. Fold it to the middle from the bottom, fold it to the middle from the top, Fold it again to the middle from the bottom and again from the top. And then 2 rubber bands, one on
Excuse me,
one
there is
side,
some, one sec. Give me a second, please.
the other side. Then you fold either side to the middle and you have yourself cloth face covering. It's that easy.
Yeah, Asta, can you hear me?
Yes, sir, we can hear you, but your video is off, just so you know that.
Yeah, could you hear the audio of my video?
Yes, sir, we heard the audio as well.
Okay, thanks. I don't know, there was some confusion here. Okay, fine. I'm returning back into my PowerPoint. So that audio, basically, I just wanted to show the easy way to make the masks at home. And please convey, it is very easy to make. People in the villages especially should not get confused that the face masks are extremely complicated and they have to buy it. They can really make it at home with any piece of cloth. So please, what I wanted to tell you is that you need to convey this to the entire population. I'll go on to the next slide. This slides are exactly what I showed in the video, so I will not show these 2 slides. I will come to gloves for a second. There are also plenty of advisories about the use of gloves, especially in the Western countries. There are a couple of kind of gloves, cloth gloves and gloves made of latex. The problem, I am not very keen supporter of gloves because the gloves, wearing the gloves actually does not give you any protection. Because if you are using the gloves and you come into contact with any contaminated person or surface, and then you touch your face with the gloves, and you are contaminated. So what you have to remember is that the gloves has to be removed before uh, going towards your face, before your hands can be brought to your face. So removing the gloves every time is a bit unpractical, and I don't think it's very effective. But the only message I want to convey here for maybe people working, sanitation workers, etc., they may want to use the gloves, but please advise them that their gloves should in no way get in contact with your face. The gloves have to be destroyed or disposed of or burnt, or if it is cloth gloves, to be worked in detergent and sun dried before reuse. So gloves have to be handled very carefully. Now, social distancing. As you can see, I saw a few questions in the chat box. What is social distancing and physical distancing? There is no difference between social distancing and physical distancing. Social distancing has really come as a phrase from the World Health Organization and the CDC. They had come up with the idea that social distancing basically means that people don't come into proximity with each other, which actually means physical distancing. So there is no difference between social and physical distancing. In fact, all of you are NGOs. I would like to highlight, even from UNICEF, we have expressed slight concern with the word social distancing, because in Indian connotation, social distancing can have other meanings also. So we do not want to bring in any kind of feeling of stigma or otherwise, or any kind of social kind of differentiation between people, or even between sick people and non-sick people. So this is not social. So we don't really encourage social distancing. We really prefer the use of physical distancing. Simply 2 meters away from each other. Earlier it was 1 meter. Many advisories still says 1 meter. But as I explained, please convey 2 meters or 6 feet should be the distance. People should not gather in groups. Why social distancing? because it has been shown that COVID-19 spreads mainly among people who are in close contact for a prolonged period. There is no definition of prolonged yet, but a significant amount of close contact for a significant amount of time is not advisable. As you can see in the photographs, many people are following, and this has spread across India. But we have also seen photographs to the contrary. People have kept their bags in this white circles, and they themselves are, standing together and drinking tea. So that is really not the correct way. You can see below the Honorable Prime Minister's cabinet meetings. So what I'm just trying to say, people have to learn to stay away. And actually, I was seeing a kind of report from the CNN yesterday, and they were saying they were anticipating that this kind of behavior may need to continue for maybe a year or so until we get the vaccine or we get the treatment for. So this will now become the new social norm going forward. And it is up to us to convey to everybody this norm. I will go to the next slide. There is one slide I just want to add here. Thoroughly wash fruits and vegetables. I have mentioned this. And the B point, make sure all bags and other items being brought from the market are washed if possible with detergent, soap and water before use. Wipe it down, maybe with wipes, clean the containers, clean the bags. We really do not know. Again, let me say, the idea is not to create any kind of hysteria or any kind of panic. The idea is, if possible, please make sure that infected bodies do not enter the house. In the slide on the right hand side, the areas which are contacted by many people, like the handles of gates, doorknobs, the buttons in lifts, if you are staying in a lift, wala building, or any place where multiple people can hand, they need to be cleaned with phenyl, with soap water, with whatever method of disinfectant that is available. I will increase my speed slightly because I'm already at quarter to 45 minutes into the session. Other important key messages, because I am a person working in water and sanitation. I know many of you, I saw the list of participants. I know quite a lot of you working in the wash sector. Toilet use, kindly make sure every day used by everybody everywhere. Disposing child feces in, I will leave that, safely is very important. Store water and food in safe hygienic manner. I have mentioned this. Container of water should not get contaminated. Matkas or fridge, the water, drinking water should not get contaminated with fingers, basically. Water should be kept safe. The last point, which is now a recent release from the Ministry of Water and Sanitation, is on no spitting. Please discourage. I know it is very difficult in India with a large number of gutka consumers. I have been campaigning for this with UNICEF, with government. There is no, of course, law against this, but spitting has to be managed to the extent possible, because it will ultimately create a problem of, it will create a hygiene issue. Handkerchiefs, if used, is to be washed with detergent frequently. You must have seen this chart, and you must have heard about the issue of flattening the curve. And most of the TV anchors speak about this, and the experts. I just want to spend half a minute here. Many people have asked, what is flattening the curve? You can see the high curve, the figures in the y-axis is the number of infected people, and the x-axis is how long. Now, as you can see with the first graph, a very high amount of people get infected in a short period, and that is the high graph. The lower graph, which is of an elongated period of time, has much lower amount of people. So if you see the total amount of patient, that is the area under the graphs, that is the total amount. Now the total amount may actually be equal in both, but The first one has a very high peak at a very short time, and the second one has a lower peak spread over a longer time. So the whole idea is that the hospitals and the health centers will not get inundated in a short period of time with a high peak. And that is why we need to flatten the curve. To flatten the curve, we have to do social distancing. Social distancing will prevent the immediate spread of infection and flatten and decrease the infection spread, as I said, and decrease the number of people infected at the same time. And therefore, the patients in the hospital will decrease coming at the same time and come over a long period of time, and the pressure will be less. So the entire effort all over the world is to flatten the curve. And the way to flatten the curve is to decrease the spread of infection. And the way to decrease the spread of infection is hand washing, use of mask, and social distancing, and staying at home. So, of course, there are other economic issues of staying at home, but I shall not go into that. This is a water and sanitation session. So we need people to stay away from each other and stop getting infected. So I hope this is clear on social distancing. I'll go to the next slide. I come to the end of part one. I think Asta wants to ask something. Asta?
Yes, sir. It's time to launch the poll. I'll just do it now. Oh, done. Thank you, Praveen.
Yes, people, there is a question on your screen. Please ask. You have, I think, half a minute.
Yes, sir.
So Asta, am I the only one who can see the screen, or everybody can see the screen?
So right now, I think Praveen is sharing the results, so everyone
Okay.
should be able to see the screen.
All right.
Please let us know in the chat box if you cannot
Yes, sir.
see the results.
Everybody can see the screen of this polling results right now. Thank you.
Okay. So
Beautiful.
yes, so as you can see on the screen, a large majority of people have said that yes, it is okay to wash mask and reuse the mask, because what I had asked was, is it safe to wash and reuse homemade cloth masks, the cloth one? And yes, absolutely correct. It is okay to wash masks and reuse the mask after washing with detergents and ironing preferably. Some people have said, no, all masks are for one-time use. 3 people have said. One have said, no, washing mask doesn't clean them, one has to buy. And 2 people have said, one can use masks and there is no need to rewash them. But I just draw everybody's attention because there are 600 people plus people on the call. So the answer there, D, is correct. Yes, it is okay to wash masks and reuse the mask after washing and after washing with detergent frequently and using ironing. Yes, thank you very much. So I close this and close my screen, and I go back to my screen, I think. Is my screen visible? Is my screen visible?
Yes, sir. We are at the end of part 1 slide. We can see that slide.
Yeah, I'm trying to go back to my PowerPoint. One sec. Yes. So I'm coming to part 2. Part 2 is on environmental sanitation, because I have around 15 minutes more to go. I think, Asta, 15 minutes, 20 minutes?
Sir, 20 minutes will be fine also.
Or 20 minutes, fine. Because I have around, I think, 7 or 8 slides. So this is on environmental sanitation. I shall speak a bit on solid waste management, gray water management, fecal starch management, and very short slides on safe drinking water, disinfectants, and waste for COVID-19. This, what I am going to say, mainly applies to, let me make very clear, I am not speaking about hospitals, I am not speaking about health centers, I am speaking about communities. We are focusing more on rural communities than urban, but of course there are urban issues here also. So please keep that in mind, more on rural. Solid waste generally is any waste that comes out from household and commercial establishments. They can include food. These are waste which have no value, and garbage, and they are maybe garbage. They are usually not human excreta, urine, and wastewater, of course, are liquid, but those are not generally included in solid waste, but other wastes are solid waste. Now, normal households which do not have any contamination issue or case should actually dispose of solid waste in the way they are disposing now. So that's what I've written: disposal of regular solid waste which has no chance on being contaminated at the household level can be disposed in the normal way as practiced currently. But items which may have become infected, like masks, gloves, containers received from the market, needs to be disposed in a safe manner so that people handling the same are not infected. This is of very crucial importance. I have seen even in urban areas, I stay in Delhi, I have seen in my colony, people are disposing their face mask in the garbage, and the safai wala person who is collecting the, the garbage from homes is using his bare hands. He is emptying dustbins into his, his can, his cart, hela, and the masks are going with normal garbage. That is really, it is unclean, unhealthy, and it is also unfair. So all such, uh, you know, all such waste material should I really think people should spread the message, should should be kept in a plastic container which is clean if possible, and properly, closed, tied with a rope or with its handles, and then disposed of, so that the cleaner or the person who is collecting the waste does not handle contaminated waste. Next slide. Safe disposal of other waste. All waste saved, all waste should be collected wherever there is a case of contaminated households, quarantined households. All waste should be collected separately and transported separately for quarantined households. The many urban departments, the Ministry of the Ministry of Urban Affairs has brought out advisories that these in urban areas, the households may actually be provided with marked yellow garbage bags. I don't know if it is being done. If it is not being done, at least in areas where you are working, please convey that there should be special bags. There should be special bags for disposing of their wet and dry waste. This is for quarantined and contaminated and households with people infected. Vehicles collecting should be thoroughly infected and cleaned every day. Waste should be finally disposed, preferably through burning. In case burning facilities are not available, as a last resort, this waste may be buried in deep pit in the ground. This is the advisory from UNICEF and World Health, and now by Ministry of Housing and Urban Affairs. So burning and putting into the ground is solutions for infected waste. Waste from non-quarantined households, as I mentioned earlier also, the waste like mask and gloves should be treated as contaminated waste and should be put into a sealed plastic cover or wrapper and told to the person collected and kept separately so that it can be disposed of safely. So this is something we really need to understand and communicate to not only the sanitation workers, but also to the households to spread, to really prevent the spread of infection. We have done most of this slide. Only thing I am, last point, the one I've highlighted, that this I'm highlighting again because there may be confusion. The triple layered surgery mask, the blue colored one, should not be reused. It cannot be washed. If it is washed, the cloth gets disintegrated. You have seen, we should not reuse it. The homemade one with much thicker cloth can be used if it is detergent, washed with detergents and iron. I just wanted to highlight that again. Now we have spoke about hand washing. So I thought we must also understand where does the hand washing waste go? Because once you put up hand washing stations in the market, there will be, places where the wastewater has to go. There will be people who will wash their hands who may be infected. So the water that is going may have traces of coronavirus, right? Right now, there is evidence to prove that wastewater has coronavirus traces. Whether it can infect other people is not proved yet. As I've mentioned in my point that I've written there in the slide, does gray water have coronavirus? As per the research results, there is no evidence of long-term survival of Corona-19 virus in gray water. However, it is advisable that every place which has a hand washing station should build a soak pit. A soak pit is a place where the water flows and can go into the ground. You see, one of the things we learn in sanitation and water, many of you are experts in wash, will know that the best filter is to put it in the ground. The soil is a very good filter. So if a liquid flows through soil, it generally gets disinfected. So the advice here is the water has to flow through into a soak pit where it does not. What is a soak pit? So a soak pit is a structure that is built where water can go and soak into the ground. Now the wastewater let me also flag before, if there is a septic sewer system there, then of course the wastewater can be put into the sewer of 300 mm height each and 100 to 150 meters of larger pebbles, 300 mm. You build that and then put a matka on top. Put a matka on top with a hole and let the, or even a plain cement structure and let the water flow into that, flow and go into this. So it's very easy to build a soak pit. That encourage everywhere that wherever hand washing stations are made, there has to be a soak pit. I come to fecal sludge, toilets. That's basically what I do. Fecal sludge, I wrote fecal sludge. I wanted to ask you all a question, but now because I've extended my time, fecal sludge is basically fecal matter, may come from humans. Human fecal matter is fecal sludge. Fecal sludge everywhere in urban areas goes into sewer systems mainly. Sometimes it goes into septic tanks. Sometimes it goes into pit toilets. As you know, under the Swachh Bharat mission, the government has built 100 million latrines all over India, rural India and urban India. The access percentage is now very high. What is important is that people should use, as I mentioned in my earlier slide, open defecation cannot happen now. People have to use the toilets. So fecal sludge management is how the fecal sludge is collected, is transported, and is treated offline. Now, does fecal sludge have the COVID virus? As I have written in the slide, there is some evidence that the COVID-19 virus may lead to intestinal infection and be present in human feces. However, I again don't want to create panic. There is no reports of fecal oral transmission of the COVID-19 virus. The risk of catching the COVID-19 virus from feces of an infected person appears to be low, but we cannot take a chance. So fecal sludge or fecal matter cannot be exposed to the environment, because exposing to the environment exposes the chance of fecal contact with humans. As you know already how flies and all, so I'm not going to go into that. It is not proved, but we have to be careful. As you know, the Swachh Bharat Mission and the World Health Organization have advocated for the two-pit model. The two-pit model is the diagram I've written. The toilet is connected with two pits. At one period, one pit is open. That pit generally, which is generally 5 to 6 feet deep, gets filled in a period of 2 to 3 years. And when that pit gets filled, the entry to that pit is closed from here, and the other pit is opened, and that pit gets filled. Again, it takes a couple of years to fill. In the meantime, the fecal sludge matter in this pit decomposes on, these are all closed pits from top. So they get decomposed on its own, and in 1 year, this can be emptied. At that time, the decomposed fecal matter in 1 year of decomposition does not have any virus or any infection. So this model is the best model because it completely removes the chance of human handling of fresh fecal matter. This is what we need to spread, we need to advocate, and we need to inform people to build. As I have mentioned in my slide below, the twin pit model is the one recommended, and this is what I request all of you to recommend when you communicate. Now, the question is what happens, about emptying. Suppose you have to empty. Now, the first point, as I mentioned, a two-pit model, because there are two pits, they should not be emptied during the COVID times. Although I repeat, there is no current evidence that the COVID virus is present in ground surface or whatever. I mentioned water, but there is, I've come, yeah, okay, sorry, this is my one, I've come back. Yeah, sorry, I jumped a slide. The twin pit latrine should not be emptied if possible. And the septic tank, no reasons to empty any septic tank or a single pit toilet or a holding tank unless they are at capacity. Please avoid, please convey, let's hold off emptying. However, if somebody's has become full, then what? Then it has to be emptied very clearly, preferably mechanical emptying. There are instruments, apparatus to empty gulpers, etc. Preferably human handling should be avoided. If human handling of any, cannot be avoided, then appropriate PPE, including long sleeve gown, gloves, boots, mask, as you can see in the pictures I've shown, and goggles, or a face shield should be worn at all times when handling or transporting excreta offsite. After handling, the person should remove the PPE and perform, I have written hand hygiene. Actually, he should have a complete bath. Soiled PPE should be put in sealed bag for safe treatment. And where there is no offsite treatment, in situ treatment can be done using lime slurry, adding 1 part of lime with 10 parts of waste. So message here is avoid if possible. If there are standard processes, this is a brief by UNICEF World Health Organization, is available on our website. Detailed steps are there, but the message is if possible, don't do it. Drinking water, I've not mentioned specifically. Drinking water, I'll just end maybe in a couple of minutes. Drinking water does not have the ones which we get from supply from municipal corporations and board do not have. Generally, they do filtration and disinfection. They are not infected, so there is no worry. However, in case of any confusion or any doubt, coronavirus, as I've mentioned here, is sensitive to chlorination. For effective disinfection, there can be chlorination. How do you know whether a water is chlorinated or not? It should have a residual concentration of free chlorine of 0.5, which can be, there are machines to check it after 30 minutes of contact time. So there is a process, details are there on our website. It's available all over the internet, so you can find it. Water can be chlorinated. And of course, one of the easiest thing to do is, in case of any doubt, you can boil water. Boiling water for more than 1 minute kills a majority of bacteria and viruses, and hopefully virus COVID-19 also. This had given details of what is a disinfectant, and from all medical shops, you can buy chlorine-based disinfect solution. You can buy phenyl, you can buy chlorine, you can buy bleach, and it's written there, instruction, how much can be done. This can be used not only to purify water, so the hypochlorite solution and chlorine can be used to clean water. It can be also used to wipe floors, other surfaces, chair, tables, knobs, etc. That is what people are using in all the sprays you are seeing. So please convey that these can be used at homes also, but after following instructions labeled on the bottom in the containers. COVID-19 patients, I avoid this slide because I've explained. I come to the end. Thank you. This slide will remain. My email is there for people who want to contact me. There is one more objective question, and then we shall have our open discussion. Yeah, over to Asta.
Thank you, sir. We'll just do the last poll of the day. Thanks, Praveen.
Yeah, this is a question. What is the proper way to safely dispose child feces? Okay, can I assume everyone can see the results now?
They should be able to, sir.
Okay, so this is very interesting. If you remember, I was speaking about it, then I stopped. I said child feces should be disposed, and I stopped because I realized I had asked this question. And very interesting answer from all of you. First of all, let me say that 69% people said disposing in the toilet. 13 and 14% said dustbin and sand, and drain 5%. Actually, okay, let me start with the 5% one. When you said drain, actually, I should have been clearer. What I had actually intended to ask you was an open drain. But let me say that drain should be avoided. So there is no question of throwing the fecal matter into the drain. So that is no. Dustbin is a no. Dustbin, because if you throw it into your dustbin, it'll go, after all, somebody will collect your waste matter from your home. Somebody will have to handle it, and fecal matter in that handling is not advisable. So that's a no. Cover it with sand and in the latrine. Preferably, the answer is you should dispose it in the latrine. That's where adults are also going, and that's where the child feces should also go. Covering it with sand can be done where people haven't got a latrine. But if you have a latrine, that is option number one. If there is no latrine, your first information or advice to that household should be please build a latrine. But if they still don't have a latrine, then they can cover it with sand. Thank you. We can stop there, and maybe we can go into Asta. You can compare the remaining part. Over.
Thank you, sir. Thank you, sir, so much for that amazing and interactive session. I'm sure we all had a lot of fun learning about these new things. And now we just have 15 minutes left for some Q&A. So what I'm going to do, sir, is I'm going to have a mix of questions that came out of the chat box, as well as some questions we will take from people who have raised their hands. So let's start with them. Sir, I'm going to unmute.
Yeah, am I visible, Asta? Am I visible on?
Yes, sir, your video is on now.
Fine, thank you. Go ahead.
Just one second. We're going to start with Mr. Paul Thomas. Mr. Thomas, I'm going to unmute you, and then you will be able to speak directly to Mr. Majumdar. Mr. Thomas, I have unmuted you. You can please ask your question. It's okay, we'll just move on to the next person. Mr. Deepak Saxena, I'm going to unmute you now. Please ask your question. Listen, children. Mr. Saxena, do you have a question? Okay, let's move on. Mr. Satyanarayan Patnaik, I'm going to unmute you. Let's see if it works this time.
Yeah, thank you. Namaskar. It's a very nice presentation from Majumdar ji. Can you hear me?
Yes,
Yes,
Mr.
thank you.
Saxena, please go ahead.
Yeah. So thank you for your nice presentation. Actually, my question is that in the basically rural and remote areas, most of the community are mostly using the pond and rivers during bathing and all things. So, and there is a huge migrants also to the area. So now most of them in quarantine, also isolation. But whenever they are using the ponds and rivers, there is a possibility of infection and all things. What is your view actually on this? Because it is also very sensitive things.
Absolutely, Saxena ji. There are plenty of issues regarding the issue of contamination. See, what I will try to say, exposure to contaminated water, whether that can infect a person is still not proven. However, one should be safe. So there are two. The only way the person can be contaminated is when the coronavirus enters the mouth, nose, and eyes. So that should be prevented. There are two ways of preventing it. One is to stopping the contaminated water from coming in contact with the face, or to make sure that if the coronavirus in the water can be killed before it comes in contamination with the body. So what I'll advise, of course, if there are cases of water bodies being completely contaminated, then we have to make sure that when the person is using that water, some kind of chlorination of that water should happen before it is put on the body of humans, like for cleaning utensils or bathing. So I don't know whether it's possible in rural areas to make sure some kind of chlorine can be added to the water. Maybe the tablets, NADCC can be added. There are tablets which can, decontaminate waters.
And sir, similarly, that open toilet also they are using in the river side and so tank side.
Yeah. So that is a disaster. So the water that is used to clean utensils or to have a bath should actually be, if there is chances of it being contaminated, it should be some kind of cleaning or chlorination, or chlorine should be added to clean that water, if possible. I know it is a hard task, but if possible, if that can be done, the message can be given, then it's possible. Drinking, of course, is an absolutely no, should be avoided. The villagers should, at least if they cannot do anything, they put the water to boil. Water can be boiled and then drunk. If they don't have latrines and they go for open defecation, the first thing they can do is to cover the fecal matter with soil or dig a small hole and put it there. Let it not be exposed to the environment. Over.
Thank you.
Thank you, sir. We'll take the next question. From Fazalul Abid, CM, I'm going to unmute you now. Yes, you're unmuted. Please ask your question. Hello? Do you have a question, sir? Okay, we'll continue to move on. Tapas Mahato, I am going to unmute you now. Mahato, can you hear us? And Suvarna Ghadke, I'm going to unmute you now. Please ask your question. Suvarna Ghadke, can you hear us? That's another child. We'll move on. Rajakumar Bhaskar, I'm going to unmute you now. Yes, you're unmuted. Do you have a question? Rajakumar Bhaskar, would you like to ask your question?
Sorry, I got the answer. Thank you.
Okay, no worries. Thank you. Okay, so what we can do now is we can take some questions that were coming in the chat box, seeing that we only have 9 minutes left.
Yes.
Let me read, I had been collating them. So there was a repeating question on using hand gloves. Will wearing gloves help towards protecting a person from coronavirus?
Very interesting question. I try to explain it. I'll try to make it clearer. You will observe that most of the organizations, WHO, UNICEF, CDC, Ministry of Health, Government of India, are not speaking about hand gloves at all. Because in the public community, hand gloves is not a very practical thing to use. And its impact is not very efficient. Why? As I explained, what happens if I put a gloves? So I have put a gloves on my hand and I continue working as if it's my hand. It is my hand, but it's only thing. So the only thing that's happening is your hand is getting protected from the infection. But if I use the gloves contaminated with viruses to touch my face or to touch my phone or to touch the door, then it is going on contaminating things. So it's not protecting you per se. So the only period where I will advise you to use hand gloves is if you have a person who is sick, and that person or who you think is sick, and you need to go near that person to give him food or to touch him, whatever, then you might use the gloves. Use the gloves, touch, do whatever, come back. As you go away, immediately take away your gloves and dispose. No way you can keep on wearing the gloves for more than for a long period of time. If you go out in the market, if you want to keep yourself absolutely safe, wear the gloves, go to the market, don't touch your face with the gloves in the entire period. When you come back, take off the gloves immediately and dispose it. Right? So gloves will help you to that extent, not more than that. Over.
Thank you so much, sir. We'll move on. So there was also a very interesting question about menstrual hygiene. Let me see if I can find that question. It says that in the context of COVID-19, how important is menstrual hygiene for women? As we know, in rural India, women are still not using sanitary napkins. So how important is the disposal of used sanitary napkins?
Now, there are two questions to this. For an infected person and a non-infected person. For an infected person, menstrual hygiene is as important now as it was before. Menstrual hygiene, whatever directions you're following, instructions you're following, whether one is using a pad, one is using a cotton cloth, or using any other safe mechanism for menstrual hygiene, please use that. Dispose it safely, exactly the way you used to dispose. The basic idea is that the waste should not come into contact with other people, whether it's a waste collector or anybody else. If you're an infected person, then of course it becomes a bit more important. It is not known whether menstrual fluid has the COVID-19 virus. I am not aware of any research which has been done on that. If there is, I'll be happy to share. But as for any other human waste, the waste material should not come into contact with uninfected humans. It should be disposed safely in maybe in polythene packets or in other in wrappers that the people are using currently. I don't know whether people are putting it in flames and burning it. Maybe that's possible. We don't generally encourage burning because of environmental issues, but maybe at this stage where no other options available, burning is an option. Otherwise, digging a hole in the ground, but it has to be sure that animals don't dig up. So there are issues in that. Safe disposal so that it does not get exposed and others should not come in contact should be the method of menstrual hygiene. Thank you.
Thank you so much, sir. We only have 4 minutes to go, so maybe we can attempt 1 or 2 more questions depending on how this first question goes. Let me go back to our participants who had raised their hands and let's see if we can get a question live. I am going to unmute you, Sasmita Jaina. Please feel free to ask your question. You're unmuted now. Sasmita Jaina, can you hear me?
Yes, yes.
Okay, great.
Sorry, can you please repeat? Because, hello, I have already put my questions in the chat box.
Has your
So
question
which
already been answered?
No, it is not answered because I have asked, is there any safety because the masks, the gloves? But I think it is answered.
Yeah, gloves I've answered just now.
Yeah, you have answered. Thank
Yeah.
you so much.
My advice again to repeat, since you have asked, maybe you have not heard.
Yeah,
I will
I
not.
heard it.
Yeah, I will. Yeah, fine. Thanks. Then I will not really encourage you to go for gloves unless you are going and handling an infected patient. Okay.
Yeah, thank you so much.
Thank you. Please mute yourself.
Yes.
Let's take one more question from Dr. Vaiti Chavla. So I'm going to unmute you now. You're unmuted.
First off, thank you very much for making me connect with Mr. Sujay.
Of course.
Mr. Sujay, there is a problem in India is the cluster colonies. Of course, we are going and telling them that's a small area where 8 people are staying together or maybe 6 people are staying together. We are telling them to have a social distance, but the next hut is adjoining. How do we handle such situations?
Yes, this is one of the major questions that we are facing right now. Here in UNICEF also, we are working with our partners in the slums of Mumbai and Delhi and Calcutta, where there are, very congested and it is not easy. Therefore, the social distancing message has to be, guided as per the situation that exists on the ground. Like, for example, even in my home, we are now 8 people staying, for example, and we have 4 rooms or 5 people, 2, 3. We are interacting very closely. It is not easy. It is not easy. But the question, at least the message should be that physical contact with unknown people should be minimized. I mean, a close contact with people with whom that this person has been safe, has been under quarantine, or has not gone out to the markets. Unke saath I mean, if you're not that strict, also it will work. But if there is social distancing needs to be very strictly applied with people with whom you do not know their history or where they are going or what they are doing. So within those closed households, maybe that much strict implementation may not be possible, but all of them can be encouraged to do regular hand washing. All of them may be encouraged not to, go out and touch contaminated surfaces. And if they do, come back and hand sanitize, hand wash. One thing I did not mention is actually of hygiene. Everybody needs to do normal hygiene. Bathing regularly, having a bath every day is very important. Let people bath, let it clean. Well, see, the only thing I saw a question in the chat box. I will just end. I just questioned. Somebody said, why is it that soap can kill the corona? The soap of 5 rupees can kill the coronavirus, but all the researchers in the world are not finding any medicine to kill the virus once it enters the body. The problem is we can't eat soap because so the issue is we have to use what we know. We know soap can kill the corona, so we need to wash hands, take bath. People staying in close confinement, we need to speak to them about hand hygiene, about human hygiene, regular bathing. Let them keep themselves clean. Let them keep surroundings clean. If outsiders are not entering their house, chances of infection are very low. It will only happen if they come into contact with some outsiders. Of course, you have to go and buy vegetables. You have to go and buy stuff. But keeping distance at that stage is the most important, which we need to convey. Over.
Thank you very much, sir.
Thank you very much, sir. This brings us to the end of our session for today. Let me just do a couple of administrative announcements before ending the meeting.
Asta, can I have one question? Is it possible for you to save all the questions in the chat box and then email me if possible?
Of course, that would be great. Thank you. Thank you for offering to do that.
Thank you. Thank you so much. Yeah, over. You can take.
Thank you, sir. So just to end the session, we have been noting all of your requests for the certificates and for how to do your quiz. So please note that this is our website. It must be on your screen right now, Sphere India COVID-19 Academy.org. Please visit this website after 24 hours because it takes us some time to input all of your data into our website. So we will try to do that as soon as possible, but just so that we have the maximum amount of time, please go to the link after 24 hours. Next to the name of this session, there will be an option which says quiz. Please take that quiz. It's got 5 questions. Once you do that quiz and you enter the email ID that you have registered for this course for, not any other email ID, then you will be able to download your certificate. But please do that after 24 hours. And if you have any other questions or any suggestions or feedback for us, please write to us at that email ID that's mentioned at the bottom of the screen, covid19academy@sphereindia.org.in. So with that, we will come to the end of today's session. Please go to our website to see our next session, which is tomorrow. And we will also be circulating the information via your available contact details that we have with us. Thank you very much and goodbye.
Thank you, Dr. Thank you, Mr. Sujay, for being there with us today and conducting such a lovely session. I think this is Valerie. This was a very good session. We got a very good response in the chat room, and hopefully we can have another session with you soon again sometime. And we will send you the questions from the chat room, and maybe you can answer them for us, and we'll upload it in our resources section on the website.
Yeah, thank you, Valerie and Asta and everyone else. It was a great experience. Thank you.
Thank you.